Good morning to all. This is Dr. Sue from Purely Pediatrics. This week we are going to be talking about wounds and wound care. Wounds are something we commonly see, particularly in the warmer months when kids are outside and spending lots of time in the dirt, in the grass, on the ball fields. We generally see lots of wounds that can occur. The first thing I want to mention is that a lot of people will be asking me about tetanus and if it's important to make sure we have a tetanus shot when we do receive wounds. And I do want you to know this, that tetanus is something we generally can get from the ground and the soil. When something occurs and it involves the ground and the soil, it does definitely put us all at risk if we are not up to date with our tetanus immunizations. I wanted to just start off with that this morning only because we do see some families that have chosen to either delay vaccinations or have decided not to vaccinate. And I want you to know that when you have a wound that does create bleeding, is deep enough to do so, that tetanus is always a possibility. I think it was last summer, we saw a little one in the Amish community that had contracted tetanus from the soil and a wound, and unfortunately did not survive. You don't hear of it very often because it is something that many of us are immunized against. And when you do have a wound that involves dirt, dust, and things like that, you want to make sure you've had a tetanus within the last 5 years. If it's a clean wound and occurs with something that's not involving the ground and dirt, then it's something that you can go 10 years. Make sure you have a tetanus within 10 years. We are always available for questions for our families, and your pediatricians are available for questions as well for your little ones. So families that do decide to hold off on tetanus vaccinations, and if they do get an open wound in their children, that is when tetanus will be highly recommended. So I just wanted to put that out there. I'll get those questions quite often at the urgent care as well as at my own clinic. So I wanted to make sure that you understood that. We can never take the risk 100% away, even with vaccinations, but you are much less likely to contract tetanus from a dirty wound if you are fully immunized for the tetanus vaccine. So I did want to make sure that you understood why that's something that we continue to recommend. So I wanted to also go into wounds in general and let you know that wounds can look much worse than they are until we clean them up. So when a little one falls off a bike or bumps his head or, creates some bleeding, I always ask families to just make sure they try to use some water and a washcloth or a paper towel, whatever you have available to you, and make sure you take a look at that wound before you feel the need to go anywhere with regard to getting that seen. What we'll do is we'll tell the families to clean it off as good as you can, see if you can put some compression and stop the bleeding, and then take a good look and let us know what you see. Depending on your pediatrician's office, you could take a picture of the wound and send it to them. We do always encourage our families to do that with us, and I know there are other doctors that would welcome the same. And that's something you can always use the on-call system for your pediatric practice and ask them if you could send a picture to the doctor on call and see if they can help you manage it from there. But once you clean the wound, running water over that wound is really ideal if you can. But many times these things happen at the ball games, outside, when you're at the playground, and things like that. So you just do your best. Even if you have to use a bottle of water, that's just fine too. With wounds that are gaping, wherever they are on the body, and gaping means that you can see two distinct sections of skin, excuse me, that are separated. And you also often see bleeding with that too. Then that's something I definitely want you to reach out to your doctor for. That may need to be repaired, and your doctor can help you understand how to pursue care from there. At the urgent care, the pediatric urgent care, we do stitches practically every day on kids. There's times we can use glue, there's times we do stitches, and there's times that we do staples. And that's something I'll make sure to talk to you about with management in the next audio. But never feel that you are on your own in how to manage a wound, especially if it doesn't stop bleeding easily. That's something I want to make sure you know you do not have to ever deal with on your own. If you see something called more of an abrasion, where it's not a true distinct two sections of skin that are separated, but it's really more of a sloughing off of the first layer or two of the skin, that's something that we just are not able to repair, and generally doesn't need to be repaired because it's just a scraping off of the top layers of the skin. That is something, if you see, that you want to make sure you clean up. And you can use antibiotic ointment and a bandage or gauze to cover that and allow that to heal. So abrasions are very different. We'll see some families that do have their little ones get abrasions, and when we tell them that no repair is needed, I know they're always relieved, but to save you from having to go into a facility to get looked at when you have an abrasion is something I'd like to prevent too, if you do notice that's what it is. But again, never feel like you have to manage these alone. So when it comes to wounds in general, very deep wounds do require treatment. And that's more immediately. You'll see that those wounds bleed quite you can't stop them from bleeding. You'll see that the wounds are deeper. You may see deeper tissues. If you see tendons or bone, things like that, that definitely needs to go right in and get seen. So make sure you give your doctor's office a call if you see something like that, and they can help you manage in terms of going to the urgent care or going to the ER, because oftentimes the emergency room will be the best place to have those things taken care of, where they can do imaging and make sure that the structures underneath that wound are intact and don't need any repair either. So keep in mind, the urgent care is a fantastic facility, but with wounds that are deeper, those are wounds that will more likely have to be sent to the emergency room if they are deep enough and require more imaging that we don't have available there. So I want you to mention one more thing, that wounds oftentimes need dressing changes 1 to 2 times a day. And if it's a wound that needs to be repaired, we always discuss with you the proper way to manage that. But for wounds that don't need to be seen and don't need to be repaired, just make sure you do your best to put an antibiotic ointment on there. It can be any antibiotic ointment that you use as a family. If there's any question about that, your doctor can help you with that too. But using a Band-Aid for the more superficial wounds and a gauze pad with an ACE wrap or an adhesive gauze wrap is a fantastic way to protect those wounds over the summer months as well. Depending on where the wounds are, that is something I want you to make sure that you ask the questions that you need to of your doctor. Is different wounds, we've got many different ways that we can teach you how to clean and how to wrap those wounds to keep them safe. I want to mention that for wounds that do not need to be repaired with sutures, staples, or glue, soaking those wounds once a day is a fabulous thing to do. I love Epsom salt. You'll hear me talk about that a lot to my families. Epsom salt and water. Even soap and water is just fine for 10 minutes, especially on the hands and the feet. Again, if they do not need repair. If they do need repair, that's something you cannot participate in because you don't want to loosen up those stitches, staples, or the glue. So immersing in water with Epsom salt or soap and water is a fantastic way to keep that wound clean. Feet and hands especially, you can use a washcloth and kind of soak that wound that way by putting the washcloth over that wound. But baths are great things if we do have, just kind of kids that fall off their bike have wounds kind of all over the place. And then soaking in the bathtub is fabulous. And that's where I love to use Epsom salt. A great way to keep the wounds clean. And then you can dress the wounds after they get out, redress the wounds rather, as they get out of the shower or the bathtub. So I think for now, that's all I wanted to talk about with wounds. I will talk a little bit more about how we know what wounds to repair, how we know what ones that don't need it, and care of a wound that does have to be repaired. So we'll talk a little bit more about that. And I guess my biggest takeaway point here is that you do never have to feel that you have to manage these wounds by yourself. These are something as pediatricians and family medicine docs or whoever you see can really help you decide what the best thing to do is for these wounds. Okay? All right, you guys. Tune in for my next session on wound care, and we'll talk a lot more about repair. Thank you.